this briefing. I would like to start by introducing myself and Mandy. Many of you will not have met us before. My name is Mary Cridge. I'm the Interim Director for Adult Social Care, and I'm leading for my part of the business on local authority assurance. Mandy, would you like to introduce yourself?
Hello everybody, and thank you for coming and joining us. So I'm Mandy Williams and I'm the Interim Director for Integration, Inequalities and Improvement. So my role is very much about leading the assessment processes for the integrated care systems. Thanks, Mary.
Okay, thank you. So as we said, thank you very much for coming. We weren't at the sessions that where the feedback was given, but we understand they were fantastic. And this is all about letting you know what we've done with that, how it's influenced our thinking and our decisions so far on all of this. I'm going to kick off with the local authority assurance, and then I'll hand over to Mandy for the ICS side of things. We've put an hour and a half in the diary because we wanted to make sure there was enough time for questions and discussion and so on. But similarly, recognising the pressure that everybody is under, if we're finished before that and can give you some time back, we'll do that. But let's see how we go. So today is all about what were the themes that we heard and what we're doing with that feedback, and we're setting out next steps. So we've had 2 co-production sessions and over 400 people registered. So we really got both the volume and breadth and quality of feedback, which was fantastic. This isn't it, it's not over. So we'll be doing further engagement as we go along. So please don't think this is a final opportunity to influence. So I'm going to talk about the overarching themes that we heard, as you can see set out here on the screen. So very strong message that we should use what currently exists and are reliable, and only go looking for different things, for the gaps. So if it doesn't exist and we feel it's necessary, we'll need to stand that up. But very much please use what already exists, and we certainly would not argue with that. We heard that we should be checking on co-production, because insight into how local people are involved will be, and how you're working with people on co-production will be a key thing in our thinking when we're looking at improvement. Mixed feelings about ratings, to be fair, and a general sense that it's a bit early, but they could be a driver for improvement. So continuing on the overarching themes, there were concerns about how we could meaningfully measure leadership. And that was across both local authority and ICS work. And we had some suggestions about considering peer review, perhaps bringing in leaders from other parts of the country to help with that, to give that sense that we would understand really what we were looking at for leadership, and a sense about being proportionate. Concerns about how this is going to impact if we were asking for information about assurance of processes and all of that. So proportionality, really important, was the message. So focusing now particularly on local authority co-production. So here's the list, very helpful list. Clear methodology for establishing the baseline data. We want to know, don't we, that we've got a good foundation consistently applied for everyone to start this off. To have that clear understanding about frequency. what will be the relationship with reports and how this will interact with existing internal reporting cycles. So really that the how's it going to work in practice feedback. Wanting us to take an holistic approach and give equal weight to quantitative and qualitative data, and consistency and no duplication. Again, you know, I think we can all sign up to that. So those were the key messages we had back around data. So co-production, wanting us to use all channels, not just digital, and look at how local authorities are using experts by experience and others in that co-production business of identifying needs and considering how best to meet those needs, and wanting us to involve local charities in reaching out to people, again, in a proportionate but proactive and targeted way. So we are making sure we're reaching out to those who've got something to say about the issue that we're trying to get information on. So strong theme on co-production, which was great. So we heard lots about ratings and reporting. So feeling that the report should be set in the context in which local authorities are operating, everything from the specific context in which a particular authority is operating in to the wider scene on reform and funding and the general stuff that in which we are all operating at the moment, wanting us to report and take context into account. Feedback that local authorities are at vastly different starting points and that we must take that into account. And of course, the current reforms and discussions impact different local authorities in a different way to a different extent. So wanting us to be cognizant of that and take that on board when we are rating and reporting. A sense that these scores and ratings might be unhelpful, and that there might be some loss of nuance if we haven't got the context right, and avoiding ranking of local authorities in any way. That's an interesting one. We rarely rank at CQC, you know, we've never done that in quite the way, but when we publish stuff, the press do it anyway. So, but a sense, CQC, please don't rank us. And from the public, and feedback about what does it mean from a public perspective if a local authority doesn't have a positive rating, where does that leave people? And I just asked people to bear in mind the outcome from some of the ADAS survey last week. The majority of local authorities only assessing where there's a safeguarding or other significant issue. So some of this what this work will be doing will be making stuff, putting stuff in the public domain that perhaps folk aren't aware of, and what's going to be the impact of that. Understand that, but this is regulation, isn't it? It goes hand in hand with improvement. Say what the situation is and say what's being done about it. But we absolutely hear that. It's a really serious point about what it means for the public. Okay, so fourth theme on leadership, look at peer review methods. I've already touched on because that came across both for local authority and ICS. And we should look at what people actually do. How are people actually treated and cared for? And that we need to look at elected members. This has got democracy in play here, differently from the NHS. Very good point. And that culture and honesty should be at the heart of any framework. Well, no argument here. Integrity is one of our core values at CQC. So absolutely, culture and honesty, that's what we want. So next theme, being proportionate. Avoiding duplication. Nobody wants that. It's so frustrating when it happens. An ask that we share the learning from the pilots and that local authorities are given a chance to implement learning and make changes before full rollout. I think learning is a continuous thing, isn't it? But we heard that very much, that's what folk want. And to understand, the feedback was understand that local authorities are one partner in a complex system, and some will be working with multiple ICSs. So absolutely, we hear that and we need to understand that in the context of this work. Okay, so what are we doing about all that then? I've given a few hints as I've gone along, haven't I? But what are we doing in response to that feedback? So on leadership, a decision that we will include elected members and overview and scrutiny committee members in seeking feedback. So we'll make sure they absolutely play their part. That we will use the outcomes from the existing peer review arrangements to inform our assessments. And that evidence relating to culture and values will be used to form assessments. And that will include looking at, well, the whole approach of all of the evidence we get, but really honing in on where that speaks to culture and values. We want to see those values passionately held in action and seeing that influencing the way people are working and their decisions. So that's the response. All work in progress, of course, but that's the definites on the leadership feedback. So rating and reporting. So this is still very much under discussion. I haven't got a settled position to share with you all, but in those discussions, we're very much using the feedback that we've heard. So there will be a narrative report at the end of assessment. So alongside, maybe not at the same time as the scores, still under discussion, as I say, but hearing what folks say about context, this will be the opportunity to set in context and to explain our findings, and that we will score the appropriate evidence categories under the quality statements to achieve a headline rating. So it won't be a blunt one overall thing. There'll be scores for different elements that will contribute to the overall rating. So that's the story so far on ratings, and we'll keep you appraised of that journey and of course where we get to. So co-production. So the assessments will definitely look at how local authorities are using co-production and the difference it's making in terms of planning, designing and delivery of services. We will definitely seek feedback from people via local representative charities and organisations. Why wouldn't we? Really important that we get the information to inform a proportionate and accurate assessment. And we are looking at ways to explore how we can use experts by experience in our assessment work. I'm sure many of you will be familiar with that phrase, but experts by experience, either somebody with lived experience or a carer in that area, have been a part of our work at CQC and have been a tremendous addition. So important that we have that framing when we're, and you said that too. So we're absolutely keen to do that. Okay, so I've rattled through that, but we can come back to any and all of that later. But at the moment, I'm just going to hand over to Mandy to cover the ICS side of things. Thank you.
Thank you, Mary. Thanks. And unsurprisingly, there are lots of commonalities around what we heard in regard to local authority assessments and for the integrated care system assessments, but I'll run through them in the same way as Mary had in the what we heard and what we're going to do. So data, again, don't duplicate. Please only use existing sets where the quality is good, and only ask for new data sources if there's real gaps in what's available. Try and look for some measures that will drive integration and inequalities in the data, and for us to really be ambitious in how we use that. Pull that data from a whole variety of sources, from wherever we can. So use multiple sources in the data. Co-production. So it's really important. The feedback that we got from you was that it was really important that we checked that co-production and collaboration was a really key part in the functionality of the ICS, how they were working, and that we encourage those leaders to really embed meaningful engagement with the residents, the people living within the ICS footprint, with their staff and with their stakeholders. So key production, a really key theme. There was general consensus that it was really too early to rate ICSs, as they're really going through that developmental stage at the moment. There was a bit of a mixed feeling, though. Some people felt that ratings could be a really good driver for improvement, but there was a really clear message that we needed to be consistent with how we judged and rated the ICSs, using the same quality statements to measure performance and to drive that improvement. We heard a lot from you about what a good leader was, and so how we needed to factor that into the assessments. So, you know, the characteristics of that good leadership, working as a team towards that really clearly defined strategy, being supportive, really pushing that learning culture, having in place measures so that barriers can be overcome to achieve good outcomes, and really putting the needs of the local population at the heart to address the inequalities and improve experience and outcomes for all the residents. Proportionality in our regulation. So a real ask that it's very our ratings and our assessments are proportionate, that we don't lead the rating of the ICS by the provider ratings. So provider ratings are separate and will be separate, and that we should only consider them in the determinant of how well the ICS is responding to the ratings of all the providers in their footprint. So that's all things that you said that you thought we needed to really consider. So this is what we're doing. Person-centered. So needing to look, we'll be looking to see that the ICSs undertake person-centered assessments and use that to inform the views and experiences of the local residents, and that they're making meaningful co-production, undertaking meaningful co-production to inform the work that they're delivering. And as with the local authority assessments, we will be continuing to engage and develop our own co-production as we develop the evidence requirements. So we've drafted quality statement descriptors that sit beneath the quality statements, and they make really clear the context in which they sit, and the quality statement descriptors really demonstrate how the single assessment framework, which we'll be using across CQC in its entirety from providers upwards, how that can be used in the context of assessing the ICS. We're aiming to start a baseline of all ICSs from April 2023, but really recognising that they'll be in different stages as far as maturity, formation and progression with their plans are concerned. So ratings, as I say, really clear that ratings shouldn't be, the rating of an ICS shouldn't just be an amalgamation of all the ratings of the providers that sit within that footprint, but needed to be clear, providing a real signal of the overall leadership, the integration and the quality of that system and how they're driving improvement. And one of the things that we're actively looking at is how any ratings could be accompanied by a direction of travel statement, so that would give that additional context away from just that pure rating, and bring in the nuance to that judgment. Really important that we listened to that proportionality. Our intelligence about providers will be considered, but isn't, wouldn't be the key determinant. That we would be including other sources of evidence that are shared through our co-production, that we take into account other regulators, other sources of information, work collaboratively with partners so that we're avoiding duplication, and really looking at that relationship between ICSs and provider collaboratives as well. And so our next steps over the coming months will be piloting our approach, and then we're wanting to do some real evaluation of those pilots to learn from it and evolve our approach over the coming months. We're going to continue to have some ongoing stakeholder engagement at some key forums and events, continuing to talk to the expert advisory group, and having a real focus on where there may be gaps identified from the pilot, so that come the 23rd of April, come April 23 rather, we're able to commence the rollout of the assessments of the ICSs. So that's what you've said to us, and how we've listened, and what we're intending to do. So now just really opening the floor to these sort of discussion points as to whether the themes that Mary and I spoke of, whether they resonate with you, whether they resonate with what you heard and what you've said, and whether you think there's anything missing. You can put comments in the chat if that's easier to you. Raise hands. There are a number of colleagues from CQC on the call as well, because I think there's about 100 of us, and I think for Mary and I to field the hands and the comments would probably be too big an ask, so we're ably supported. So open the floor to you all.
Thank you. I'm just going to take the slides down so that we can see people. And we've got a hand up from Sharon, so we can come to you first.
Hello, Sharon, over to you.
We can't hear you, Sharon. I don't know if you want to mute and unmute again.
Can you hear me now?
Yes,
yeah.
Thank you.
Okay, that's great. I just wanted to understand how the three lots of inspections really link into each other, the provider inspections, the ICI and the local authority. I'm just a bit unclear about that, because there seems like there could be some crossover.
Yeah, so provide, if I have a go at this, and the policy colleagues on the call might want to join in. Okay, so we're looking at different, for the provider, and for ICS and LAA, we're looking at different responsibilities there. So the provider is has been our standard business. We have our requirements to register, monitor and rate on the provider side. So that's sort of slightly to one side. Now, of course, we'll need to take when we're looking at an area, either through the LAA or ICS lens or a combination of the two, of course, we'll take account of what we know about providers, but what we're not doing is amalgamating ratings from providers and saying, look, the sum of the parts gives you an overall view. It'll be more complex than that. So it'll be information from the provider side alongside any other. We might have some clues from that provider work as to how well, we were talking about social care providers, for example, how well their relationship is with the local authority, the support they get, etc. So we'd have insight from that. And on the NHS side of things, we're already looking at how the leaders of NHS trusts are working with stakeholders and partners. So we'll have that sort of lens. So I think the bit that's not yet completely resolved and that we're working through is the relationship between the local authority assessment and the ICS. Now, hearing, which we completely endorse, all the issues about duplication and so on, we want to avoid any sort of repetition, duplication. But when we think about an ICS area, the local authority assurance obviously will be a part of that sort of thinking. One will inform the other, but as to their actual direct relationship, I think we're still working that out. But I'm going to pause there and invite any policy colleague who's on the call to add to what I've said.
Thank you, that's really helpful.
Dominique, who's trying to got a hand up there?
Yeah, I just going to add to, Mary's explained that really clearly, but just a couple of additional points that might highlight some of the issues. So in relation to providers, we'll still have the 5 key questions. So we will consider, is it safe, effective, caring, responsive and well led? For an ICS assessment, there are 3 themes that are on the face of the Act, which are around leadership, integration and quality and safety. And then for the local authority assurance, the legislation is quite specific around compliance with the Care Act duties. And obviously, an assessment of a local authority is only sort of one component of place when we think of the number of other partners that form a place. But completely understand the points, and I think they're questions that we're grappling with ourselves. In terms of things like sequencing, that's one of the main reasons for doing pilots, because we've been very clear in terms of the principles that we've set out that we're not wanting to cause burden or duplication. So we will be aiming to test some of this in our thinking. I think there was another point in the chat about which assessment should come first. So sequencing will be a really important part. So hopefully that just adds to some of the points Mary's already helpfully outlined.
And can I bring in Dave James as well? I think he's got his hand up.
Thanks very much. Both great questions from my colleague. Great answers from my colleagues, and a great question too. The only thing I'd add is this is particularly complicated whilst we establish this baseline that we've talked about. This first 2 years where we need to understand exactly where ICSs and local authorities are in terms of quality of delivery. We need to establish that baseline. From there on out, we're kind of in this more agile, iterative process, and we can be much more kind of flexible to the issues that are happening. So the actual order beyond that period is less important, and actually it's much more about what's going on in this area, what do we need to follow up, what evidence do we need to gather. But yeah, we do need to work out for that baselining period what's the best way of what is the ideal order, really.
Thanks.
Right, I think we had a hand up, Sarah. Godfrey, I think, at the very start. So.
Hi, good morning. Thanks very much, Neil. My question is about timing and scheduling of the inspection. So for a local authority, in practical terms, what should we expect from the CQC from April 2023 when this new framework takes effect? would the CQC inspect all local authorities at the same time? Would there be a sort of role? How do we engage with the process, and what would be the level of communication between the CQC and local authorities who would be inspected at particular times?
Thanks. Shall we, Dave, do you want to come in?
Yeah, sure. Thanks for that question. We'll know more once we've piloted. We're about to pilot with 2 local authorities to test this process. It won't be all at once, that's for sure. So it's a bit like with the previous response. We need to work out what's the best way of using the resource that we've got available to us to do this work. There'll be some distinct stages though, so we'll be very clear way ahead of when we switch this on what the evidence requirements are for each of these quality statements. And we're working at the moment with we've been working with a couple of local authorities in detail, as well as with LGA and ADAS, on being really clear what the evidence is for those quality statements. So you will know as a local authority what it is that sits under the safeguarding aspect, for instance. We'll also be really clear what it is that you can supply to us ahead of what I'll call inspection, I suppose, to use the air bunnies, ahead of any kind of direct engagement or on-site activity we might need to do. There'll be chance to submit any documents that are relevant. Also, self-assessment would be a key part of this. Any peer review that might have happened. We really want to harmonise with what already works in terms of sector-led improvement, and actually just see where we can add value. So how can we fit into those rhythms, what already exists? And then it's just simply a question of, and what else do we need? Of our published evidence requirements, what is it that we must get from, let's say, an interview with the DAS, or by attending local groups where we can meet people that are using services and get their experience. So it's what can we use? It's already there, and then what do we need to do to top that up? But we'll be able to say more after we've done the pilots as to how long we think those things will take and who needs to be involved, and we'll be able to say more about that in a few weeks.
Okay, I think we've got Annie Bliss has a hand up for a question.
Yeah, thank you. That was really clear, and I think good to see lots of the kind of points that I've heard others raise during the sessions and other sessions come through. So very supportive of most of it. I think question around accountabilities, it was good to see that you kind of mentioned this under the proportionality theme. It would be good to see this come through quite strongly in the kind of guidance and the handbook that systems and providers will receive. I think obviously there's a lot to work through in terms of how do you actually, in terms of ICS ratings and assessment, look at the added value of ICSs, and I think that's where the 4 purposes comes in. It was good to also see that mentioned under the co-production theme. I think there's a lot of support for the 4 purposes. There's a lot of kind of energy behind them, and I hope this comes across quite strongly across the piece. I think it should be on the face of the framework. I think also we need the CQC should kind of look to support the shift towards outcomes. I think we're a bit expecting the messenger review to kind of say, system is a task focus, but actually, regulation has to make sure that they're enabled to move towards outcomes, and that is a system-wide challenge. And again, that was mentioned, I think, in relation to leadership and data. But yeah, again, another thing that I think could be good to come across all the themes. I think there's just another point around the fact that this is a very different way of working and relating to those who you will be assessing. So kind of the tone with which this framework comes across. I think system leaders will be really useful kind of partners in this co-production phase to provide examples and the depth of sophistication of these new structures that we're working in. And I think for you and also for NHS England, it will be about kind of asking the right questions and about kind of, and I know this is sort of the approach we're taking, but not prescribing, what an ICS is, what an ICB is, what an ICP is, how they do that co-production with communities, but actually, asking how are you doing this in your place, and then, doing the assessment from that point. I think in terms of the sort of implementation of the framework, it needs to be kept permissive and nuanced, with lots of different approaches to implementation. There isn't just one, and I think again that's something that you're considering, but just to kind of reflect feedback I've heard from sort of system leaders. I think especially in year one, I would support, you know, not having ratings. And when you do look to produce ratings in the future, because they, you know, they do have a useful purpose, I think it will be working with system leaders on the best way to do that as well. What else? Oh yeah, also good to see the mention of peer review. It's something that at the NHS Confederation we're often we have our peer support offer, and it's something that we're looking into a lot. I think ICB leaders are very keen to take part in CQC inspections as specialist advisors, so it's just about kind of getting that in diaries and maybe thinking of some rules around that. So, you know, do we have people going into a different geographical areas, I think you mentioned. So yeah, very supportive, and just a few things to add colour to what you've said. Thank you.
Thank you, Annie. Can I just add something on the peer review bit, because actually we are really keen that there are senior executives from each ICS put forward to come and join our specialist pool, so that when we do these assessments, we are accompanied by somebody from outside of that area to do that sort of peer review, to support, to challenge, and to help to spread learning and improvement. So for them to take good things back into their own ICS. So that's very much the message that we're spreading. As we're doing a sort of a virtual walkthrough of all ICSs at the moment, talking to them about the proposed processes, and our message is we want somebody from each ICS to join us, so that we can use that as a really good tool to provide peer support, peer scrutiny and shared learning.
That's really good to hear. Thank you.
Thanks, Annie.
Okay, next person with a hand up, Debbie Young. I think we had someone drop out, but if Debbie's around, ask a question, that would be great.
Hi, yeah, so it's just, and you might not be able to answer this, so it goes back to the earlier question in terms of the interdependencies around the ICS assurance and the local authority assurance, and I guess it's something just to bear in mind if it can't be answered at the moment, but you would expect similar responses hopefully to come from each around things like partnerships and how they work together and safety, etc. So if they are not done kind of side by side, so for example, you've done the local authority assurance, and then sometime later you do the assurance of the ICS, would you then go back to review the local authority narrative or rating, whatever it might be, if there was a substantial difference in terms of what you were finding when you actually did the assurance of the ICS?
I think that would probably be a question for David. David, on this one.
Can I say I think it would depend? I think it really would depend on the individual case, and does it wobble what we've said already significantly? Does it call that into question? And really that is a key aspect and benefit of the model we want to eventually step into once we've baselined, is that we're able to be reactive and able to respond to things without, you know, kind of previous regimes it would have been, well, the next inspection isn't due until, you know, for another 18 months, so we'll pick it up then. It's actually, oh, there's something here, you know, a very targeted follow-up. So but it would really depend, I think, on the issue.
Okay, thank you.
Really good points, Debbie.
Yeah, Stuart's asking, are we still on target to publish the local authority methodology in September? That's not a timeline I recognise, but yes, we are. I think I know plans are still developing, but yeah, you know, I think we're really keen to publish this as soon as we can, because otherwise there's a risk of a vacuum. So absolutely. And Carol, do you want to come in?
Yeah, thank you. Really helpful feedback today. Can I just say that? Thank you. It does feel that you've listened to us, so I just wanted to get that message over. In terms of integration for ICSs, I'm really pleased that you have recognised that we're going to be in different stages as we develop in its early days, and particularly for the initial baseline. How then do we get parity of assessment, given that everybody is going to be at different stages of that process of integration, so that it's not a subjective statement? Because undoubtedly, whether we like it or not, people are going to compare results of ICSs, even if they're completely different in their makeup. So how are we aiming to get that parity so that it is almost an apples and apples?
Yeah, I agree. It's that is going to be a real challenge, but that's where we want to bring in that sort of commonality of quality statements that we assess on, and really back it with narrative and direction of travel. And I think the direction of travel is probably one of the most important things that we're going to be, we're wanting to support ratings with. And I think we're hearing very much that people don't want ratings in that very first early stages, that it's far too early in the development of ICSs to be able to do that sort of comparison. And as you say, people will compare. And if you've got a simple one word, one picture, whatever it is, rating, that's all that people will see. But the direction of travel is the really important thing, I think, to be for us to be reflecting back in the outputs. Dominique, I don't know if you want to add anything to that.
I suppose, Mandy, just to say, that what you've just highlighted about the direction of travel, the capacity to improve is really important. I mean, ultimately, it is CQC's role to offer that independent assurance to the public. So, there will be, and we recognise there will be that geographical variation, but I think it's making sure that the assessments have a value add within the context of where things are at the moment. And that's why we're so keen to have a chance to pilot our approach rather than just jump into the process without having thought all these issues through. It's really helpful that a lot of the questions you're raising are things that we have in mind. So that means we're not too far off the mark in terms of how we're developing going forward.
Thanks. And it's not also, so for me, it wouldn't just be about geography. So if I think of my own ICS, integration technically should be easier because it's only 2 local authorities, but my ICS next door is 7 local authorities. So it's not just about geography, it's about complexity, isn't it?
Yeah.
And I'm really sorry if I missed them, but it would be really helpful if you could share the draft quality statements again. That would just be really helpful. Thank you.
Yeah, we can do that, Carol.
Yeah. And Godfrey, do you have another question?
Hi, Neil. Thanks again. My question is really related to the last discussion about context, which I think it's every local authority can make a strong case that we all have unique context. So how would that then link in to any possible ratings which the inspection leads to? So that's one part of that. The second part is, what would we be thinking, what indicators would fall under that concept of context? Is it areas of deprivation, geography, or it's quite a broad context. And I just wondered whether there'd been any thinking at all about what the indicators might be, because leadership arguably is an element of that context as well. And those democratic structures are also part of context. So how would that inform any consideration of ratings?
I can try and answer that. Thanks, Godfrey. Absolutely, context would be really important, and as part of that initial information that we'd be looking for local authorities to send, there'll be documents to send to us, self-assessment, as I said, and any peer review that might exist. Also, crucially, the context and anything that you feel as a local authority is important for us to take into account. There has been some work done. I don't think we have any colleagues from our data and insight team with us, but there has been some work done to start to map out at a more detailed level what the indicators might be. The building on what we did with our local systems reviews, essentially. So it is very much about the local context and the demographics and deprivation and those kinds of things. But again, I think that's something we can come back to through our engagement sessions and make sure we're capturing those in the right way. And certainly the kind of the political and leadership aspects are something we've heard as being important to take into account. And then I think how that plays into ratings is something that, again, as we pilot, we can test that out. I think there's a balance, isn't there, between needing to be consistent and a kind of applying a standard, but at the same time recognizing the situation as it may be on the ground, which brings us on to another benefit, I suppose, of this duty that we've been given, which is where issues are effectively out of control of the local authority, where the circumstances are such that they are doing the best they can. That's a really important message for us to be able to play up to government and to policymakers. That's a really important part of our role here, using our independent voice to set out the kind of the challenges, I suppose. But yeah, the context needs to be weighed in as we're considering, as we're coming to those judgments for each of the topics that the quality statements describe.
Are there any other questions that anybody got any other burning questions? If not, I think it maybe is coming to its natural close. What I would say is that we've noted everything that's been shared in the chat. So there are questions around wanting timelines, when publishing methodologies and so on. All those have been noted. We've recorded this, so we'll be able to reflect back on the questions that you asked and make sure that they're being taken into consideration. And this isn't the end. As we've said, we want to continue to engage and iterate our processes to make them a really good product for when we start in earnest next year. I can see there is another hand.
We've got two hands, Mandy. So I think Matt was first, Matt Herbert.
Hi, I was just wondering if you considered what the mix of virtual meetings and physical meetings will be. Will you actually be on the ground in the authority visiting places, or will you just be attending virtually? Has that mix kind of been worked out?
It's a very good question, Matt. We haven't worked that out. We're very keen to test that on the pilots, but we don't want to come in and move in for a week. Things that work well virtually, we'll be wanting to do those virtually, and things where it'd be better to be in the room and hear direct and talk direct, then we'll do that. But we want to get that right. Proportionality really important here. Thank you.
Yeah. It's not going to be prescriptive, Matt, and as Mary says, we're not going to turn up in a bus, but there's likely to be a combination of the two for ICS. Some time on the ground doing some face-to-face work, and we've always got to be flexible for when key individuals aren't able to be available, so that it'll be a mixture of the two. And there is another hand.
Debbie.
Yes, so obviously you mentioned the focus around Care Act duties for local authorities, and also you made reference to the recent ADAS survey. So when obviously you've done a number of local authority assurance visits or inspections, whatever they are, will you be pulling together any sort of key themes to sort of escalate? So for example, you know, some of the stuff that's come out of the ADAS survey, you would notice if you visited any one of those individual local authorities. So will there be some kind of escalation route, or is that something you're working through, where you're coming up with these themes which are kind of consistent across, you know, a reasonable sample of authorities?
That one for you, Mary?
I thought Dave was about to speak. But...
All right, so yeah, sorry, absolutely, Debbie. I mean, we'll be sharing our findings with the department, as we'll be required to do. So there's always that line there. And I think what's worked so well as we develop this is that genuine kind of partnership across LGA, ADAS and the department and ourselves. I think we'd want that to continue as this goes live, but definitely working out the best ways to group together what our findings, and so it has the maximum impact is something we'll be wanting to do. And certainly, obviously, as a minimum, as part of our state of care reporting, but also other means as well to really shine a light on the issues that we're finding.
Oh, thank you. I was going to ask about the state of care report, so no, that makes sense. Thank you.
And the same really goes for ICS assessment. So, you know, we're wanting to be driving improvement on those local ICSs, but we'll also be pulling out themes and have that escalation route to be able to give that independent voice of the state of care, if you like, across the whole country. So where we see commonality themes, we will be able to speak out about that.
Thank you.
I think we're out of hands, Mandy.
I think we are. So as I said, take a note, and you know, this isn't the end. This is still part of the road to get to where we all want to be. So thank you very much for your time, and for attending today, and for all of your input. And from me, have a really good rest of the day, and I'm sure the same from Mary.
Yeah, absolutely. Thank you. Great questions.
Thank you. Take care, everybody. Bye-bye.